In this video, we're going to talk about transposition of the great arteries, specifically D-transposition of the great arteries. On the left side, you can see an example of a typical heart. Here is the right side. This is the left side. The nomenclature it's kind of flipped because we're going to be talking about it as if the patient is facing us using their own sides. Anyhow, blood goes from the right side of the body. It's blue because it doesn't have oxygen. It goes to the right atrium, down to the right ventricle. This pumps it against the pulmonary artery, that's the low pressure lung artery. There, it picks up oxygen from the lungs. It turns red, goes to the left atrium, down to the left ventricle, and then this pumps it against the high pressure aorta. That's the major artery in your body, which then delivers oxygenated blood to your brain and your other organs. On the right side, you can see an example of transposition of the great arteries. The major defect is that these great vessels are actually reversed. Your aorta, instead of coming off of the left side, comes off of the right side, and your pulmonary artery, instead of coming off of the right side, it comes off of the left ventricle. If you follow the blood, you can see why this is a major problem. Blue blood comes back to the right side, it goes to the right ventricle, but then the right ventricle is connected directly to the aorta. So the aorta delivers blue blood without oxygen to your brain. There is some oxygen that actually ends up going from the left side to the right side up to the brain via these holes called like an atrial septal defect. But overall, this anatomy is not compatible with life, and it's actually a surgical emergency. There's two major types of repairs that surgeons used to do. The first one that was developed is called an atrial switch operation. It's either a mustard or a sending, and the difference between those is really just the type of material they use. But essentially what they do is they leave these two great arteries in place, but they reroute the blood returning to the heart, back to the proper ventricle. So, blue blood comes back, but instead of going all the way to the right side, it's actually baffled through these pant legs. You can think of them kind of like a tube, all the way to the left ventricle. This left ventricle is still connected to the pulmonary artery, which then it pumps it to the lungs, and then the blood goes to the lungs, it picks up oxygen, turns red, comes back through the vein, and back to the right side of the heart, which then pumps it against the aorta. Now it's red and is delivering oxygenated blood to the brain, whereas before, what was getting through was only blue. This worked great, and it allowed survival up to adulthood, whereas previously this would have been fatal in infancy. However, one of the major issues with this is that the pressure inside the aorta is a lot higher than the pressure in the lungs. And so this ventricle on the right side is not used to pumping in such high pressures. And over time, that can cause a deterioration in its function. The squeeze can become poorer, and that can fail over time, leading to other issues, particularly heart failure. So, they developed a new type of operation called an arterial switch. Now, instead of just rerouting the blood, we leave that the same, but we actually just put the big major blood vessels back in their place. You could think like, oh, that's way more straightforward. Why didn't we do that in the first place? Surgically, it was a little bit difficult, so it took a lot of innovations. But essentially, you just take the aorta that used to be on the right side, you put it back on the left side, and you take the pulmonary artery that used to be on the left side, and you put it back on the right side where it belongs. The major advantage here is now your right ventricle pumps against the low pressure lung artery, and your left ventricle, which is a lot stronger, pumps against the high pressure aorta. There's still some issues, namely in like the coronaries. These are the blood vessels that supply the heart muscle. This part can get dilated, and you can have some narrowing at the branched pulmonary arteries. But overall, this is an amazing surgery and a huge improvement over the initial atrial switch.